Good evening, everyone.
Yes, ma'am.
Myself, Dr. Aanchal. As we have started the exam mastery live classes, in which we do rapid revision of all the important topic. Also, we discuss volatile facts here and high yield topics of all the subjects we cover in this series. And also, we discuss most expected topics for the university exam. So, as we have started the CVS. Before starting with CVS, let's discuss some core feature of Oracle. So in Oracle, we provide live classes for the elevated learning of the student. Also, we provide recorded sessions. Recorded sessions are here so that the student can have the access of all the classes anytime, anywhere. Then also notes are being provided which contain CVB-based question answers, MCQ and full zone for self-assessments. Then MCQs are there from beginner level to expert level, which contain standard choice multiple questions. Then in exam mastery live classes, today we are going to have CVS class 4, in which we're going to discuss the shock and different stages of shock. Also, we're going to learn about the compensatory mechanism. Then we're going to learn about Frank-Starling law, ejection fraction, regulation of cardiac output, in which we're going to discuss the homometric and heterometric mechanism. Then we're going to learn about the heart failure feature. Then cerebral circulation and measurement and factor affecting it, we're going to discuss. Then factors affecting cerebral blood flow. Also, we're going to discuss, in which we'll deal with the auto-regulation. Then we're going to discuss about this stroke. Then we're going to learn about the splanchnic circulation and portal hypertension. And in last, we're going to learn cutaneous and fetal circulation. So let's start with today's class. So in Oracle also we provide subscription plan. So subscription plan starts from basic, means from 3-month plan to 12-month plan. In mentorship plan, we provide services like pre-recorded classes, live class, slide doubt clarification, one-to-one personalized guidance, notes, quick revision examination module. So this plan costs around 50,000, and also for instant 20% discount, you can use my code, that is Dr. Aanchal 20. Also, you can book a slot for personalized counseling session. And let's start with today's topic. So first, we're going to learn about ejection fraction. Okay. So what is ejection fraction? Ejection fraction is the fraction of end diastolic volume, as we can see in the slide also. Just wait. So this is the fraction of end diastolic volume that is ejected out each ventricle. Okay, so we can write that this is the fraction of end diastolic volume that is ejected out by each ventricle. Okay, and also for ejection fraction, we have a formula that is stroke volume upon end diastolic volume. So we can determine it, as we know that stroke volume is 70 ml and end diastolic volume is 120. So we get the ejection fraction is 58%. Okay, and also normal ejection fraction is usually lies between 55% to 65%. Okay, so this is all about ejection fraction. Now next we have a very important law, that is Frank-Starling law. Okay, so we know that cardiac output is directly proportional to the force of contraction, right? So provided the other three things that start how the cardiac output is directly proportional to force of contraction, we have this law to prove that. Okay, so that law states that force of contraction of heart is directly proportional to initial length of the muscle fibers before the onset of contraction. Okay, and force of contraction depends upon two things. The first we have preload, and second we have afterload. Okay, now what is this preload and what is this afterload? So preload is basically the stretching of the cardiac muscle fiber. Okay, so this is the stretching of cardiac muscle fibers at the end of diastole, means just before the contraction. Okay, and this occurs due to increase in ventricular pressure that is caused by filling of blood during the phase of diastole. Okay, now next we have afterload. So what is afterload? Afterload is the force against which ventricle must contract. Okay, so this is the force against which ventricles must contract and eject the blood. Okay, so the main aim of the afterload that to apply a force so that there will be ejection of the blood. Okay, so force is determined here by the arterial pressure, and also at the end of a phase, that is isometric contraction period, the semilunar wall, as we know, they got open, and finally the blood get ejected into the aorta and in the pulmonary artery. Okay, now next we have the another thing, that is cardiac output regulation. So in the last class already we have learned that what is cardiac output, what are the factors that are regulating cardiac output, what are the variations. So already we have learned the cardiac output. So in today's class we're going to learn about the regulation. Okay. So we know already that sympathetic activity and epinephrine, if both get increased, so ultimately it will result in the increase in the heart rate, and the cardiac output also get increase. Okay, so we can easily say that the cardiac output depends upon two factors. The first is heart rate and the second is stroke volume. If any of them get increased, so cardiac output will get increased, and if any of them get decreased, so cardiac output will get decreased. So here uh, with the help of sympathetic activity and epinephrine, there is increase in the heart rate, so cardiac output is increasing. Then next we have, if there is increase in the venous return, the blood is increasing in the right atrium, so there will be increase in the end diastolic volume, which leads to increase the strength of the cardiac contraction, just that what we have learned according to Frank Starling mechanism. So it will leads to increase in the stroke volume, and it will leads to increase in the cardiac output. Right now, next we're going to learn about the two important thing, that is the control of stroke volume or the intrinsic auto regulation. Okay, so that is done by two mechanism. So we're going to learn about heterometric regulation and homometric. Okay, so hetero means different, and metric means major. Okay, so what is heterometric regulation? Heterometric regulation means here there will be change in myocardial contractility. Okay, so there change in myocardial contractility, and as we have learned that hetero means different, metric means length. So there will be change in myocardial contractility that varies with initial length of the muscle, or we can say initial length of the cardiac muscle fibers. Cardiac muscle fibers. Okay. Then another thing we have is homometric. Homo means same and metric means length. So here what will happen? There will be change in myocardial contractility, but there will be no change in the muscle length. So you need to remember that what is heterometric and what is homometric. Okay. So in one, there is there will be change in the myocardial contractility that varies with the change in the length of the muscle fiber. And here in homo, there will be no change in the length of the muscle fiber. Or in another word that we can learn, that it is independent of resting length of cardiac muscle fibers. Okay. Here in heterometric, the effect is independent of cardiac nerve supply. Okay. So the effect remains independent of cardiac nerve supply. There will be no effect as such of cardiac nerve supply will be seen. But here in homometric, it is dependent, and it is dependent upon both sympathetic as well as parasympathetic. Okay. So whenever there is sympathetic stimulation, means there will be increase in the contractility, and whenever there is parasympathetic stimulation, means there will be decrease in the myocardial contractility. Okay. So it will responsible for increasing and will be responsible for decreasing. Okay. So that's how the heterometric and homometric both works. Okay. Now, one more thing is there, that what are the factors that are responsible for affecting the myocardial contractility? So factors that are responsible for affecting the myocardial contractility. So we have that myocardial contractility get increased by the catecholamines. Okay, so that effect is mediated by beta 1 energic receptors through CMP pathway. Okay, then whenever there is stimulation, what already we have learned, stimulation of which, sympathetic or parasympathetic? Yes, sympathetic. Sympathetic nerves, or whenever there is change in heart rate and rhythm. Also with the help of, or with the effect of some drugs, and those drugs like digitalis is there. Okay, so digitalis is there because digitalis inhibits sodium potassium ATPase in the myocardium to increase the intracellular sodium. Okay, so this decrease the calcium efflux, and finally they will be increasing the calcium availability in the cell. Okay, so this is all about whenever there is increase in the myocardial contractility. Okay, another thing, what happens when there will be decrease? So what are the factors that which are responsible for decreasing the myocardial contractility? Okay, so myocardial contractility decrease by the stimulation of vagus nerve. Okay, so vagus nerve to the heart produces a negative inotropic effect. Okay, or if myocardial infarction is there, which causes the part of the myocardium to become fibrotic and non-functional. Another condition, in condition like hypercapnia, hypoxia, acidosis, or intrinsic myocardial depression. Okay, so what is myocardial depression basically? This is leads to heart failure, and there will be decrease in the catecholamine content of the myocardium, so that there will be production of negative inotropic effect on the myocardium. Okay, so these are the factors responsible for increasing myocardial contractility, and these are responsible for decreasing. Okay, fine. Now, next we have the cerebral circulation. Okay, and cerebral circulation is considered to be the important one. So you need to learn it, like investing more knowledge and more time. Okay, so what is cerebral circulation? This refers to the flow of blood through the blood vessels of brain. Okay, as we can see that the name cerebral indicating that there is a flow of blood inside the brain. Okay, so it refers to flow of blood through the blood vessel of brain. Okay. And here we know that brain tissue required adequate blood supply continuously. And whenever there is stoppage of blood to brain for even for 5 seconds, so it will lead to unconsciousness for 5 minutes, and also it will lead to repairable damage to the brain cells. Okay. So the continuous supply of the brain, the continuous blood supply to the brain is very, very necessary for the normal functioning also. Okay. Now, there are several blood vessels are there that we call cerebral blood vessels. Okay, so brain receives the blood from basilar artery. One we have basilar artery and internal carotid artery, and branches of these artery from the circle of Willis. Okay, that form a circle of Willis, as we can see in the diagram also. Now, the venous drainage by the sinuses which opened into the intrajugular. Okay, so venous drainage by sinuses that opened into intrajugular, internal jugular. Okay, if we talk about the normal cerebral blood flow, means normally how much amount of blood is received by the brain. So normally brain receives 750 to 800 ml of blood per minute. So it is approximately 15 to 16% of total cardiac output. Okay. Now, another thing we have that what are the factors that are responsible for regulation of the cerebral blood flow. So we're going to learn the regulation under three headings. First, we're going to know about the autoregulation. Then we're going to learn about chemical factors, and third, neural factors. Okay. So we know autoregulation, like many organs are there. Okay. Like kidney, okay, liver. So like other vital organ, the brain also regulates its own blood flow by the process of autoregulation. Okay. So autoregulation in brain has got its own limitation, and the autoregulation depends upon three other factors. So what are those three other factors? The first we have effective perfusion pressure. Second, we have cerebral vascular resistance. And third, we have cerebral blood flow. Okay. So this cerebral blood flow is directly proportional to balance between effective perfusion pressure and the vascular resistance in brain. Okay. Now, one by one, we're going to learn what is effective perfusion pressure. As the name suggests, effective perfusion pressure. So this is also a balance between the mean arterial blood pressure and the venous pressure across the organ divided by resistance. Okay. So as we know, the venous pressure is 0 in the brain, means mean arterial pressure plays a very important role in regulating cerebral blood flow. Okay, so the process of autoregulation is possible in brain if the mean arterial pressure is within the range of 60 to 140 mmHg. Okay, and autoregulation fails beyond this range. Okay, if it will fall, then also it will fail. If it will exceed above 140, then also it will fail. Okay, now another thing we have is cerebral vascular resistance. Okay, so what happens when the vascular resistance is more? Okay, so the blood flow inside the brain will get less. Okay, so resistance to the blood flow in brain is offered by intracranial pressure, CSF, and the viscosity of blood. Fine. So this is all about autoregulation. Now next we have the another factor, that is chemical factor. Okay, so chemical factors which increases the cerebral blood flow, that leads to decrease in oxygen tension, increase in CO2 tension, and increase in hydrogen ion concentration. Now, as we know that this CO2, carbon dioxide, is the most important factor as it is responsible for causing the dilation of cerebral blood vessels, which leads to increase in blood flow. Right? So whenever there is a moderate increase in carbon dioxide tension, that will not lead to alter any change in the blood flow due to process of autoregulation that already we have done. So when the arterial pressure, partial pressure of CO2 that rise above 45 mmHg, that time there will be increase in the cerebral blood flow. Okay, so at that time the CO2 will combine with water to form carbonic acid, and immediately, as we know, carbonic acid H2CO3 is an unstable product, so it will be immediately dissociate into bicarbonate and hydrogen ion. So the hydrogen ion is responsible for causing the dilation of blood vessels in brain. Okay, fine. Now next we have the another factor, that is nervous factor. Okay, that is the last one. Now what is nervous factor? So we know that in nervous factor usually we know about the ANS. Okay, here we're going to know the ANS. So cerebral blood vessels are supplied by sympathetic vasoconstrictor fibers. So, but these fibers do not play any role in regulating cerebral blood flow under normal condition. So, in pathological condition, like in condition of hypertension, so there will be the sympathetic nerve causes the constriction of cerebral blood vessels, which leads to reduction in blood flow. Okay, and all this is occurring in the condition like hypertension. Okay, so it also responsible for preventing cerebral vascular hemorrhage and the cerebral stroke. Fine. Now, next we have the splanchnic circulation. Okay, so this is also known as visceral circulation. Okay, because it is responsible or it is constituting three another portions, that is mesenteric circulation, splenic circulation, and hepatic. So, as the name suggests, mesenteric means it is responsible for supplying blood to GI tract. The splenic is responsible for blood to spleen, and hepatic is responsible for the liver. Okay, now the unique feature of this circulation that the blood from mesenteric bed and spleen form a major amount of blood flowing to liver, and blood flows to liver from GI tract and spleen through the portal system, right? Now, we're going to know that the distribution, okay? If we talk about the distribution, so in stomach, it is 35 ml per 100 gram per minute. In intestine, it is 50 ml per 100 gram per minute. And in pancreas, it is 80 ml per 100 gram per minute. Okay, and the regulation of this mesenteric, as we are talking here about the mesenteric. So, the mesenteric also the regulation done by the local autoregulation with the activity of GI tract. Okay, so whenever there is contraction of the wall of the GI tract, that reduces the blood flow due to compression of blood vessels, and there will be relaxation of wall to GI tract, which leads to increase in the blood flow due to removal of compression on the blood vessels. And also several nervous factors are there, like the mesenteric blood flow is also regulated by sympathetic nerve fibers. Okay, so whenever there is increase in the sympathetic activity, as in the case of emotional condition like flight and fight condition, so that will be responsible for the constriction of mesenteric blood vessels. So more blood will get divert towards the organ like skeletal muscles, towards heart and brain, which needs more during these conditions, right? So this is all about mesenteric. Now next we have the splenic. Okay, so as we have done that, splenic circulation means supplying blood to spleen. Okay, so this is the main reservoir for blood, and due to dilation of blood vessels, a large amount of blood is stored inside the spleen. And whenever there is constriction of blood vessels by sympathetic stimulation, which leads to release blood into the circulation. Fine. Now, finally, we have the third one, that is hepatic circulation. So we know that for liver, the sources we have, that liver receives the blood from hepatic artery, portal vein. Okay, so liver receives maximum amount of blood as compared to any other organ. Like if we talk about heart, kidney, so liver receive maximum amount of blood. Okay, so most of the metabolic activity is also carried out by the liver, and blood flow to liver is approximately about 1500 ml per minute. Okay, so that is 1500 ml means it is forming 30% of total cardiac output. Okay, so normally we know that 1100 ml of blood flows through the portal vein, and remaining 400 is flowing through the hepatic artery. Okay, so portal vein carries only about 25% of oxygen to liver, and it is because it carries the blood which has already passed through the blood vessel of GIT, where oxygen might have been used. Okay, so hepatic artery transports 75% of oxygen to the liver. Fine. Okay, so this is all about the visceral and splanchnic circulation. Now, next we have, okay, one more thing, that how the regulation of blood flow to liver occurs. One more important thing. So, the regulation of blood flow to liver occurs through systemic blood pressure. So, systemic blood pressure is the important factor which is responsible for blood flow to liver, and hepatic blood flow is directly proportional to systemic blood pressure. Okay. Another thing we have, splenic contraction. So, due to splenic contraction, there will be increase in blood flow to liver. Okay. Then, movements of intestine. So, motility, if there is any kind of motility present in intestine, it will lead to increase in hepatic blood flow. Then chemical factors are also there. Okay, so chemical factors which are responsible for increasing blood flow to liver by vasodilation. Certain chemical factors are there whenever there is increase in CO2 or lack of oxygen or increase in hydrogen ion. Okay, so these all are the factors. Fine. Now, next we have the another important topic, that is cutaneous circulation. Okay, so first we should know that what is cutaneous circulation and what is the main function of this cutaneous circulation. So this is responsible, or it helps in the regulation of body temperature, and also for, if we talk about the nutritive function, so it is responsible because skin needs very less blood. Okay, so first function we have, that it's supplying nutrition to skin. Supply nutrition. As the name suggests, cutaneous means it is supplying blood to skin. Second, it is responsible for the regulation of body temperature by the process of heat loss. Okay, so we know that cutaneous blood flow is regulated mainly by body temperature, and here the most important thing and that regulation means the most important structure that is present in brain, that is hypothalamus, and hypothalamus is the organ that is responsible for the regulating the cutaneous blood. Okay, so what happens whenever there is increase in the temperature? Okay, so increase in temperature means there will be activation of hypothalamus, right? So hypothalamus activated, and hypothalamus in turn will cause the vasodilation. So vasodilation by acting through the medullary vasomotor center. So what will happen? The vasodilation will be there. So there will be increase in blood flow to skin. Okay, and increase in cutaneous blood flow causes the heat loss. Okay, so there will be heat loss from the body through the process like sweat, and when the body temperature is low, vasoconstriction will be there inside the skin, and therefore the blood flow to skin decreases and prevent the heat loss from skin. Okay, so this is all about the cutaneous circulation. Then another we have the very important topic, that is fetal circulation. Okay, so as the name suggests, fetal means the circulation that is occurring in the fetal life. Okay, so fetal circulation is slightly different from the adult because of the presence of placenta. As we know that in fetal life, there is a presence of placenta, and we know that fetal lungs are non-functional, and here the placenta is the only structure which is responsible for the exchange of gases between the fetal blood and the mother's blood. So the blood from right ventricle is diverted to placenta. As we can see from the right ventricle, it gets diverted to the placenta directly, right? So, the development of heart inside the fetal life is completed at the 4th week of the intrauterine life, and it starts beating at the rate of about 65 beats per minute. Okay, so along with heart, the blood vessels also get developed, and heart rate gradually increases and reaches up to 140 beats per minute, right? So, now, as we can see, the fetal is also connected through the placenta with the help of umbilical arteries. Okay, and the maternal blood runs through the uterine vessels, right? We can see. Okay, so now we're going to understand this fetal circulation and how it occurs. So we know that fetal lungs are non-functioning, so there is no necessity of large amount of blood to be pumped into lungs, right? So instead, the fetal heart pumps large quantity of blood into the placenta for the exchange of substances. Okay, now from placenta, the umbilical vein is going to collect the blood which has more oxygen and more nutrient, right? Now this umbilical vein passes through the liver. Okay, so it passes through the liver, and some amount of blood is supplied to liver from umbilical vein. This umbilical vein is also supplying this liver, and then from the umbilical vein, there will be a supply of blood to inferior vena cava. Okay, and as we can see, the large quantity of blood is supplying to or diverted from umbilical vein to inferior vena cava through a ductus, that is ductus venosus. Okay, so here the liver receive blood from portal vein also and umbilical, right? So in liver, the oxygenated blood mix with the slightly with the deoxygenated blood. So here it enters the right atrium. From inferior vena cava, it enters through the right atrium through the inferior vena cava. Okay, now from right atrium, major portion of blood is getting diverted to left atrium. We can see through foramen ovale, right? And foramen ovale is opening to intra-arterial septum, right? From right atrium, then to left ventricle, and then to finally aorta. And some amount of blood is passing to right ventricle, then from right ventricle to pulmonary trunk, then to lungs. As we know, lungs here are non-functional, then from pulmonary vein to back to left atrium, and finally to aorta. Then from aorta to systemic circulation, and from systemic circulation to umbilical. Okay. So the blood from upper part of the body enters the right atrium through superior vena cava, and from a right atrium the blood enters into right ventricle also. From here the blood is pumped into pulmonary artery. As we can see, the pulmonary trunk is there. Then from pulmonary artery the blood enters the systemic aorta. Okay, and that systemic aorta through the ductus arteriosus. Okay, and only a small amount or small quantity of blood is supplied to fetal lung, very small quantity, and blood left from left ventricle is pumped into aorta, and about 50% of blood from aorta reaches the placenta again through the umbilical arteries. Okay, so this is all about the fetal circulation. Next, we have the another important topic, that is shock. Okay, so shock is a very important topic. Usually it is asked in the university exams also. So what is shock? Shock means the depression or suppression of body functions. In the simple term, if we study that what is shock, so this is how we define shock. Okay, depression or suppression of body function produced by any disorder. Right. If we talk about the manifestation in different system of body, so if we talk about the characteristics feature, so characteristics feature of all types of circulatory shock is due to insufficient blood flow. Okay, so what is the reason that it occurs? Due to insufficient blood flow. Blood flow to tissue of the body, particularly brain tissue. So major causes of decreased blood flow is the reduction in the cardiac output, and cardiac output is reduced during various conditions, and very common condition when cardiac output gets reduced, that is loss of blood or due to vasodilation or due to cardiac disease, or whenever there is any kind of obstruction to blood vessels, right? Now, what are the compensatory mechanisms? So compensatory mechanism we're going to learn with the help of flowchart. Okay, so what happens whenever there is acute loss of less than 10% of blood, total blood. Okay, so if blood get lost approximately 10%, so there will be decrease in venous return. Venous return is decreasing, means it will lead to decrease in cardiac output, means there will be decrease in blood pressure. So if all these things are decreasing, so it will ultimately lead to compensatory mechanism that we're going to learn. Okay, now how the things get compensated. Okay, so that we're going to learn with the first the effect of baroreceptors. So first baroreceptor mechanism is there. Okay, so baroreceptors will lead to vasoconstriction. If vasoconstriction is there, means there will be increase in blood pressure, right? Also, the condition like tachycardia will be there due to stimulation of baroreceptors. So, there will be increase in cardiac output and increase in blood pressure, right? Another thing, what happens in the renal mechanism? In renal mechanism, there will be secretion of a very important hormone, that is renin. And as we know, renin gets secreted through JG apparatus. So it will lead to formation of or conversion of angiotensin to, and angiotensin will cause the secretion of aldosterone. Now, aldosterone, how aldosterone will work? So, to know the work, first we should know the role of ADH mechanism. So, the ADH will lead to water and sodium retention. Is water and sodium, more and more absorption of water and sodium will be there. So it will lead to increase in blood volume and there will be increase in cardiac output. Okay. Again, the secretion of this aldosterone will lead to water and sodium retention, which leads to increase in blood volume and increase in cardiac output. Okay. So where there will be increase in cardiac output means there will be increase in BP. Okay, so all these mechanism like baroreceptors mechanism, renal mechanism, and EDH mechanism are responsible for compensating the condition like shock. Fine. Another thing we have that whenever what happens whenever there is acute loss of blood between 10 to 15% of total blood. Okay, so what will happen? There will be again reduction in venous return, reduction in cardiac output, reduction in BP. Okay, so what will happen? There will be first there will be suppression of vasomotor center. As we know, the vasomotor center is responsible for causing dilation. Okay, so whenever there is suppression means the vasomotor center will lead to dilation, vasodilation. Okay, so there will be severe vasodilation. If severe vasodilation is there, means there will be decrease in blood pressure and it will lead to thrombus formation in capillaries. So it will lead to thrombus. Thrombus means clot, right? So it will lead to obstruction and obstruction will lead to increase in hydrostatic pressure. Hydrostatic pressure will get increase. Okay, so there will be fluid diffusion to interstitial space. And finally, there will be deterioration of other tissue. So this is how all the mechanism works. Okay, fine. If we talk about the various types, so the various types are there. Like first we have hypovolemic. Okay, hypovolemic means there will be less presence of blood, low volume of blood is there. Okay, so what is hypovolemic shock? Hypovolemic shock leads to decreased blood volume, and this is also known as slow shock, and it does occurs when there is acute loss of blood, that is at least the 10 to 15% of total blood. Okay, then another we have is vasogenic. In vasogenic shock, we study about like in vasogenic shock, basically the blood volume remain normal, and this type of shock occurs because of inadequate blood supply to the tissues. Okay, due to increase in the vascular capacity. Okay. Now the third we have cardiogenic. As the name suggests, cardiogenic. So what happened in cardiogenic shock? This type of shock due to any kind of cardiac disease is present. Okay, like arrhythmia is there, congestive cardiac disease is there. Then finally we have obstructive shock. Okay, so shock develops due to obstruction to blood flow through circulatory system. So that is known as obstructive shock. So what kind of obstructions are there? Like if tumor is there, yeah, obstruction to of blood vessels are there in lungs due to embolism or any other condition. Okay. Then another thing we have is heart failure. So what is heart failure? Heart failure is the condition in which heart loses ability to pump sufficient amount of blood. Okay. Failure of heart to pump sufficient amount of blood. Okay, so the heart failure can be acute, chronic, and congestive. Okay, acute means, as the name suggests, acute means it refers to sudden and rapid onset of sign and symptoms of abnormal heart function. Okay, and the symptoms can be severe initially. Okay, and this type of acute heart failure lasts for a very short period of time. Condition get improves rapidly. Okay, then chronic heart failure. Chronic means it is occurring for a long period of time. Okay, so here the symptoms appear slowly but in remain persistence for a long period of time, and also it become worse gradually. Then third, we have congestive heart failure. So it is a general term that is used to describe the heart failure, and this kind of conditions result in the accumulation of fluid in lungs and other tissue. And when the heart is not able to pump through the aorta, the blood remain in aorta in the heart, and it will cause the dilation of the chambers and accumulation of blood inside the veins. Okay. Then what are the causes of heart failure? So various causes are there, like due to arrhythmia. Arrhythmia means irregular heartbeat, right? Then hypertension could be the another cause. Then coronary artery disease is there, then it could be the reason. Then if any kind of defect present in the heart walls, if the person is diabetic, it can be leads due to the condition like anemia, lung disorders, various causes are there. Okay. And if we look for the sign and symptoms, that what will be the sign and symptoms that will first appears if the person is having heart failure. So various common sign and symptoms are there, like chest pain, okay, and fatigueness, weakness. They will be short of breath. The person will be start hyperventilating, right? Then fluid retention will be there. Weight gain will be there. Nausea, vomiting. Okay. So various signs and symptoms are there if the person is having heart failure. Okay. Fine. Last, we have the portal hypertension. So what is portal hypertension? Portal hypertension is considered to be the most serious complication of advanced liver disease. Okay. So scar tissue in the liver, that is cirrhosis, leads to compression of the blood vessels that running through, and also reduces the blood flow. Okay, so this can also affect many other organs through the body, and it can also lead to serious internal bleeding and other problems. Okay, so what is portal hypertension? Portal hypertension means elevated blood pressure in portal vein, and also in other smaller vein it can also leads to elevated pressure. Okay, now if we talk that when we get this portal hypertension, so portal hypertension is the most common cause that is caused by the cirrhosis of liver, and that's why when long term of liver disease is there, that will leads to portal hypertension. Okay, then if we talk about the sign and symptoms, so various sign and symptoms are there, like there will be appearance of vomit in vomiting, blood will be there in vomiting, blotting stomach will be there, swelling lungs is there, then mental confusion is there, right? So sign and symptoms that there will be blood in vomiting, blotting, stomach, weight gain is also the another one. Peat edema, or we can say the swelling inside lung. mental confusion. So various signs and symptoms are there. Then any kind of complication can also occur due to portal hypertension. So yes, so the condition like ascites, GIT, bleeding, hypersplenism, low blood oxygen, kidney failure, many complications are there that can occurs due to portal hypertension. But if we talk about the common cause of portal hypertension, so cirrhosis of blood is the cirrhosis of the liver is the very common one that leads to portal hypertension. Okay, so this is all about the today's class of CVS. So I hope you find this class more helpful. So thank you so much for watching my class.